Hi everyone, my name is Dr. Asamoah. I'm a GI specialist in Houston, and today I wanted to take a minute to talk about a very important topic that all my patients ask me about. When do I take a prebiotic, a probiotic, and what the heck is a postbiotic, Dr. Asamoah? So very, very good questions, because there are a lot of supplements out there, right? And you got to figure out what's actually going to work for you. What do you need? What you don't need, right? So let's start with prebiotics. When we talk about prebiotics, we're really focusing on foods that nourish that microbiome of your gut, right? Food that nourish the bacteria, the virus, the fungi, get them to do their job, which is digest, absorb, help with motility, sustain your immune system. And honestly, you don't really need a supplement. You get a lot of that food by eating lots of things rich in fiber, right? Anything that's super rich in fiber, like whole grains, wonderful. But then also fermented foods enriching your gut. That's a prebiotic. So things like sauerkraut, fermented kimchi, great sources of prebiotics, artichoke, onions, garlic, jicama. Some simple examples of natural prebiotics you can get. But yes, you can get them blended up in a prebiotic supplement. They're usually fiber rich, okay? Now, when it comes to probiotics, now these could be dead or alive or live microorganisms, dead or live microorganisms, bacteria for the most part. Sometimes they are going to be soil-based, right, which can sustain the gastric acidity. Sometimes they are going to be yeast-derived, like Saccharomyces boulardii. But what we love about probiotics is that they help diversify and re-strengthen that microbiome by repopulating it. So a great probiotic is one that has lots of bifido, lots of lactobacilli, but it's not a one-size-fits-all, right? As some patients do really great on a very diverse probiotic, high strain volume, high strain count, and some people do well with a very simple single strain probiotic, and some people do well with the spore-based probiotic. So it really depends on the person, and it depends what underlying issue we are actually trying to treat. So when it comes to probiotics, remember this, guy. It's not a one-size-fits-all. I recommend, in my practice, I recommend different probiotics depending on what that person is dealing with. Like, did they just come off a bunch of antibiotics? Or are we treating post-SIBO? Are we treating a yeast infection? You know, these days we're actually trying to figure out what probiotics are going to work for certain disorders. So we know that some of the lactobacilli strains will be better for our patients who are suffering from mast cell issues like high histamine response or histamine sensitivity to food. So we know there's some other probiotics, other lactobacilli strains that are going to be much better for our patients dealing with constipation, right? For in terms of my patients with diarrhea, depending on the cause, I love to use a good Saccharomyces boulardii to restore that gut flora. So it's not a one-size-fits-all. The dose depends, the diversity, and how a patient tolerates it. So it has to be customized. It's also important to know, like, what's the context, right? Why am I using this probiotic? And then finally, the one that patients are always like, well, what the heck is this? That's the postbiotic, P-O-S-T, like post office, postbiotic. So this is typically reserved. This is actually very, very helpful. It is really the byproducts of what bacteria make in your gut, like, you know, the wonderful short chain fatty acids, any protein, any of the byproduct metabolites that bacteria actually form is what you're actually giving back to your body. So it's actually like the end result, right? It's the final product, right? It's like the cake, right? It's you've got the icing, and you got the eggs, and you got the water, and you got your gluten-free flour, and now we're delivering the final product. This is actually the active ingredient, like the active product that's going to work for your body, right? And so it's a gluten-free, dairy-free, whole grain cake. It's a good cake, right? It's a healthy cake, nutritious cake. But anyway, so postbiotics are really those final byproducts, metabolites that the cells in your gut, your enterocytes and your colonocytes feed on to do what they need to do, right? To help boost the immune system, to protect your body against cancer, to metabolize and balance out that insulin resistance. That is actually what postbiotics are helpful for. And so it's almost like a very modern way of getting fecal microbiota transplant, right? Instead of doing the actual transplant, we are actually looking for what will this transplant of microbiota do? What will it release? What are the byproducts that it will release that are going to be super helpful for the body? So it's like taking the cleaner version of everything, right? So that's postbiotic. So we spoke about a couple things. We talked about prebiotic, probiotic, postbiotics, how diversity is important, how your underlying condition is important, and when it's important to take which one. What's really I really want to stress out is talk to your healthcare physician, practitioner to help you figure out what to do. Don't just grab on anything because it's not a one size fits all. Everyone responds differently. Some people have a lot of gut issues when they start a new probiotic. So I think talk to a healthcare physician and make sure that they understand what your underlying situation is. Okay. I hope you guys found this super helpful. And if you did, please go ahead, follow me and put in some likes. My name is Dr. Viviana Asamoah. I am a GI specialist. I'm a holistic expert, lover of everything that's integrative and functional medicine. My practice is based in Katy, Texas. That's West Houston. Our practice is the Houston Gastro Institute. And keep following along. Thank you.